So, good afternoon, sir. So, today I am going to perform the gastrointestinal system or the GIT. So, sir, my name is Jana Isabel Guno. I am your student nurse for today. So, may I know your name?
I'm Paulo Constantino.
So, the purpose of this procedure or this examination is to check your abdominal area if there is any problem. So, I have here prepared the equipments needed for the procedure. The stethoscope, small ruler or tape measure, and a small pillow. So then, I will going to wash my hands and I will instruct the patient to void with the prior procedure, and I will place the patient in a supine position. So, sir. So, since, sir, the patient has no hospital gown, assume that he has wearing the hospital gown, and he is shy in exposing his abdomen. So, assume that the patient is topless. So, I will expose the epigastric area and the symphysis pubis of patient. And maintain the privacy to the patient. I will state the sequence of the steps in assessing the abdomen, which is the IAPP, the inspection, auscultation, percussion, and the palpation. And the rationale for this is so that we have an accurate assessment of bowel sound, and the delays more of uncomfortable maneuvers for the last, and to prevent any rupture of blood vessels in case of the presence of aneurysm. So now I will do the inspection. I will identify the 4 quadrants: the right lower quadrant, the left lower quadrant, the left upper quadrant, and the right upper quadrant, and the organs within located with the quadrant. So I will inspect for the skin, for the following color, venous pattern, or integrity. Then I will inspect for the umbilicus for the following position and color. And I will inspect the abdomen for the following contour, symmetry, surface, motion. Then I will state for the findings of patient. So far, sir, well, upon inspecting the abdomen of patient, the findings of patient is normal. There is no any abnormalities. So next, sir, I am going to do the auscultation. So I will auscultate for the vowel sounds using the following sequence: the right lower quadrant, the left lower quadrant, the left upper quadrant, and the right upper quadrant. So I will auscultate by using the diaphragm of the stethoscope. Assume that when we auscultating in each quadrant, we auscultate in 5 minutes, but i-assume tala nga hindi siya i-assume tala nga 5 minutes. So after I auscultate the vowel sound, I will state for the different vascular sound that may heard on auscultation. the brutes, the venous hum, and the peritoneal friction. For the brutes, it is an audible vascular sound with turbulent blood flow, while the venous hum is the virtually diagnostic of portal vein, and the peritoneal friction is the creaking or grating noise. Then I will now locate. So I will locate for the different areas where vascular sound may be auscultated. And for brutes, I will auscultate in the abdominal aorta, renal, iliac, and the femoral artery. And the venous hum is in the epigastric and periumbilical area. And the friction rub is in the hepatic and splenic. So next, after the auscultation, I am going to do the percussion. So I will percuss for all the quadrants for percussion and note tones in up and down manner, starting from left lower quadrant, then note for the areas of tympani and dullness. Then I will percuss and measure your liver span at the mid-clavicular line and the mid-sternal line to assess for the size of the organ. Then I will percuss in the below of the umbilicus of client in right clavicular line or the MCL, and percuss upward until you hear the dullness sound. Then I will mark the point and percuss from lung resonance in right MCL to dullness and mark. Then I will repeat at mid-sternal line to measure this with small ruler or tape measure. I will percuss below the umbilicus of client's right mid-clavicular line and percuss upward until I hear the dullness, and I will mark this point. Then I will percuss from lung resonance in right MCL to dullness and mark. Then I will repeat it in the mid-sternal line using a small ruler or tape measure. So right mid-clavicular line, percuss. So I will mark this line and here. So I will measure using this tape measure. The normal mid-clavicular line is 6 to 12. So the patient has measurement in his mid-clavicular line is 11. So next, I will percuss in his mid-sternum line. So the patient has 5 centimeter in mid-sternal line. So next, I will percuss for the spleen at the left mid-axillary line between the 6th to 10th rib. I will percuss for dullness by percussing downward in the left mid-axillary line. Then in the beginning with lung resonance until I will hear the splenic dullness. Then I will ask the patient to inhale deeply and hold breath. Then I will percuss lowest spaces at left anterior axillary line. So, sir. So, sir, inhale and hold your breath. Inhale and hold your breath. Matian, go na. Then next, I will percuss the kidney using the kidney punch. I will place the flat part of my left palm in the area of 12 rib, and I will punch the back of patient in with my left hand with my right. Then I will repeat on the left side, placing a palm slightly higher. There should be no tenderness for normal finding. So my left. Ay. So next is I will do the palpation. I will state the purpose of light palpation. The purpose of light palpation is to detect your areas of tenderness and superficial masses. So I will lightly palpate for all the 4 quadrants using my fingertips and to check for the tenderness, consistency, and masses. Then I will use my flat part of fingers for deep palpation. So the purpose of deep palpation is to detect masses and size of organs. I will palpate for the light palpation using my fingertips. Sa right lower quadrant, sa left lower quadrant, sa left upper quadrant, sa right upper quadrant. So I will palpate for deep palpation. I will use the flat part of my finger in the 4 quadrant. So I will identify the area and proper placement of my hand, position for a liver palpation. Then I will stand at client's 11 to 12 ribs. Then I will place my right hand parallel to the right costal margin. So sir, breathe deeply. Then I will press upward with my right finger with each inhalation. So sir, breathe deeply. go. So next is I will identify also the area and proper placement of my hand position on the spleen palpation. So, ito ang spleen. Then, I will stand at client's side, and reach across the client to place my left hand under the client's posterior lower ribs. Then, I will place my right hand in the rib margin. Then, I will push off. Then, I will ask the patient to breathe deeply, and I will press my hands together to palpate the spleen on inhalation. So, sir, breathe deeply. So, normally, it's not palpable. So, next is I will going to perform a special maneuver. So, first is I will perform the measure abdominal girth using a same rule. I will use this tape measure. So, the next special maneuvers for testing the ascites is a fluid wave test. So, the patient is in the supine position, then the pressure is applied by patient or the examiner in mid-abdomen. The examiner has one hand to flank the. So, the patient placed his hand in the mid-abdomen. Then, I will perform the fluid wave test. Special maneuver in checking the ascites is the shifting dullness. So, a patient is in the supine position, then I will percuss across the abdomen towards the middle abdomen with the point of transition from tympani to dullness. So, after I percuss in the side to middle, I will roll the patient side away from the examiner and percuss from the umbilicus to flank area. So, percuss. So, sir, go over. So, roll your side. So next is I will performing the special maneuver for checking the appendicitis. So first is I will do the rebound tenderness. I will do the Blumberg sign. So I will press the right lower quadrant of the patient which the appendix is located. Then I will ask the patient if he feel any pain. So, sir, do you feel any pain?
No.
So, the next special maneuver in performing the appendicitis or checking the appendicitis is the SOA sign. So, sir, roll in your left side. So, sir, let me know if you feel any pain. Do you feel any pain?
No.
So the last special maneuver in checking the appendicitis is the obturator sign. So sir, tell me if you feel any pain.
No.
Do you feel any pain?
No.
Next is I will going to perform the special maneuver for cholecystitis. Choleo- cholecystitis. So I will do the Morphy sign. I will ask the patient to inhale while my fingers are hooked under the liver border at the bottom at the rib cage. So this Morphy sign is inspiration causes the gallbladder to descend onto the fingers, producing pain. The gallbladder is inflamed. So sir, tell me if you feel any pain. So inhale. Do you feel any pain?
No.
Isa pa. Inhale. Do you feel any pain?
No.
So, the last special maneuvers that I'll be performing is the test for asterixis. So, the test for asterixis is to persistent involuntary flapping tremor. So, sir, hands. So, sir, I am done now with the gastrointestinal system or the GIT. So, the findings of the patient is normal, and all the tests that I have done is has a normal finding. So, thank you.